Welcome to another segment of Med Hour with Dr. Stella. To all my new subscribers, welcome. Thank you for joining us. To all my old subscribers, welcome as well. I'm glad to have you here. This video will conclude our segment that we've been having since the past 2 weeks on high blood pressure, stroke, and heart disease. Today I'm going to talk to you about cholesterol, having a high cholesterol. Cholesterol is found in our body, in the liver. It actually helps our cells to be healthy. It helps us build up healthy cells. We do need cholesterol. But when the cholesterol is very high, then it puts you at risk for heart disease. With heart disease, you're bound to have adverse reaction, sometimes heart attack. So that's why it's very important for us to make sure our cholesterol level is at this optimal level. High cholesterol does not give you any symptoms. You don't feel any headache, any pain, or anything associated with high cholesterol. So how do we know that you have high cholesterol? We really wouldn't know until we do a lab work on you. If you're doing your physical examination, your doctor can order a lipid panel to check what the level is. If it turns out that the level is high, that's where we need to start treating you and start monitoring you. We want your level to be less than 200 mg/dl. There are other tests we can find out different types of cholesterol tests that we'll do when we do your total cholesterol. The LDL, the HDL, the triglycerides. Please check out my Instagram. I have an Instagram content that I posted that listed everything you need to know about these levels, the HDL, LDL, triglycerides, things you need to do to make sure that you are maintaining your levels and you predispose yourself to heart disease. Then the question is then, what causes cholesterol? At least 3 things I can tell you. The first one is, number one is unknown. Sometimes people have cholesterol, we don't know the reason why they have cholesterol. They are eating the right diet, exercising, they don't have any family history of it, but they do have it. So that's an unknown origin. The next one is the food we eat. The food we consume can make our cholesterol be high. The last one is our family, our genetic makeup. We don't decide what our family gives us. You don't decide what your parents or grandparents give you down the road is in your gene. But you can help yourself in terms of the food you eat to curtail what you eat so that you can maintain your high cholesterol, make it low, or maintain it at the optimal level. What are the risk factors that can predispose you to having high cholesterol? The first one is poor diet. Like I said, diet is one of the causes. If you indulge on food that are high in cholesterol, you are bound to have a change in your cholesterol. Saturated fat tends to make our cholesterol go up. We get saturated fat from animal products, meat, goat meat, poultry, chicken. If you eat chicken without taking off the skin and you eat it with the skin, you are eating saturated fat. Milk, we do have skim milk or no fat milk, but if you take 2% milk, you are asking for high cholesterol because that's a saturated fat. Even the palm oil we used to cook, palm oil is, although it's from a plant source, but it's very loaded with saturated fat. So use palm oil sparingly if you have to use palm oil, and also coconut oil. These two are very bad for you in terms of your cholesterol. The second thing you have to watch, another second risk factor, is obesity. When your body mass index is more than 30, that's very high. It predisposes you to having high cholesterol and puts you at risk for that. Lack of exercise. If you don't exercise, you gain more weight. Exercise helps with your HDL. When your HDL is at its optimal level, also helps with your cholesterol. So ensure that you're exercising. Like I said, go back to my Instagram. You'll be able to understand what is HDL and the things you need to do to maintain that. Another risk factor that you need to be aware of is smoking. Cigarette smoking damages the blood vessels. When your blood vessel is damaged, it's difficult for blood to flow as it usually would do. So when you're smoking, you're putting yourself at a great risk of having so many illnesses, especially heart disease. So please quit smoking if you can to help your heart. Another thing too you could do in terms of risk factor is to watch your sugar content intake. If you're diabetic, make sure your diabetes is controlled. Ensure that you're taking your medication. When you have very high sugar content in your blood, it contributes to high cholesterol, damages the organs and the blood vessels. You don't want that. So if you're diabetic, ensure you're eating the right food. Ensure that you're taking your medications as prescribed so that you can control it and don't put yourself at risk for cholesterol. We will get to diabetes, things you need to do, things you need to eat in one of these segments, and I will let you know. The last risk factor that you have that can predispose you to high cholesterol is your age. Our body chemistry changes as we age. So as you age, all the lining of your arteries tend to age as well, predisposing you to high cholesterol. So that you cannot control, but other things you can control through diet and exercising and making right choices. So as we conclude this segment on high blood pressure, stroke, and heart disease, I want you to take away, if not for anything, at least that you need to watch what you're eating, be aware of the food labels that you are consuming, be aware of your environment in terms of exercising, avoid stress, manage your stress so that you can be able to do the best to give yourself a better outlook in your health. I will see you again in my next segment. For the meantime, thank you and be well.